a new type of cells, stem cells. It's called the small mobile stem cells. These are stem cells that have very unique characteristics and have a very novel mechanism of actions. And we would like to introduce them to the orthopedic world. We currently are using them also in a phase 1 trial to treat COPD patients. So I'm going to talk, of course, about joint diseases. This is most relevant here. And I'm going to do it very quickly. So, of course, we all know how prevalent these type of joint diseases are, so I'm not going to elaborate much on that. When we have a disc disease, for example, what we see in there, or we see significant tissue changes, including ossification, changes in the matrix. We have innervation of the nerve endings inside. We have deterioration of annulus fibrosus and the nucleus pulposus. We have also vascularization, which is actually exacerbating the inflammation, the strong inflammation of the. We see the same thing also with the knee joints. Now, there have been other cell therapies attempted, and they're still being attempted. One of the problems is that this environment, the intra-articular space, is very hypoxic, and there's a low pH, high osmotic pressure, and high mechanical load. And that's really affecting the survival of the cells heavily. Unfortunately, SMS cells are very resilient to all these conditions. SMS cells are very tiny cells. They are 4 to 5 micrometer in diameter, and they are very translucent, have high mobility. The size is actually very good because we can do intravenous injections and access all the areas in the body. That's unlike other cells that are large and can clog the capillaries, such as mesenchymal stem cells, for example. We received so far 7 patents for the application of these cells. Now, we draw blood from the peripheral blood, actually, and we can isolate these cells in a patented way and then grow them to large extent. These cells are true stem cells, so you can grow them to a huge extent. They have a very special mechanism, as I mentioned. They're very responsive to their media condition despite resilience. So, for example, they strongly bind and interact with mesenchymal stem cells, fibroblasts, and most importantly in this context with human chondrocytes. So they affect the gene expression of these cells very heavily, and that's key. Of course, as stem cells, they can differentiate to other cells. They can do it after many, many passages, like 27 passages. So they remain potent after extra vivo, ex vivo proliferation for many, many passages, something that other adult stem cells cannot achieve. And they have other very interesting features. For example, they can form structures by themselves. That is indicative of their intelligence. You know, we think that these cells are very intelligent. Stem cells are in general, but these seem to be even more. They secrete also extracellular matrix. This extracellular matrix is quite angiogenic. We can differentiate in that extracellular matrix the endothelial cells into small tubuli and even form large vessels, as you can see here in the video. These large vessels are visible to the eye. That's the only stem cell actually that can do that, and we can isolate these vessels. So they are quite angiogenic, which made us actually worry about their effects intra-articularly, because we don't want the cells to be angiogenic in that environment. So we're happy to say that they aren't in that particular environment. In other tissue environment, they are androgenic. They bind very strongly to mesenchymal stem cells. This is very important because these cells are very much a contributor to the healing of tissues, and they also cause the differentiation into chondrocytes. So chondrocytes are differentiated from mesenchymal stem cells. So having these mesenchymal stem cells stimulated, proliferated, moved toward regenerative state is very important. This is what the SMS cells seems to do on mesenchymal stem cells. That's just a video describing how strong these tiny cells can attach to mesenchymal stem cells. They actually attach to them immediately, and they travel with the mesenchymal stem cells. As I mentioned, they actually stimulate the proliferation of these cells. So there is no negative effects at all of these cells on all the primary cells that we have tested so far, and we tested a lot. So this is an endogenous cell therapy. That means SMS cells stimulate endogenous cells to regenerate tissue. This is very important because that means that the produced tissue is completely compatible with the host or the patient in this case. So we studied the interaction of SMS cells with chondrocytes, and what we observed was quite amazing. We have more than 4,000 genes that's being changed by SMS cells interaction with the chondrocytes. And we see these examples here. To the left, we see the control that involves more than 4,000 genes that are active or inhibited, and then the change after adding the SMS cells. So we see significant changes in activation. We can go through all the mechanisms, but if we take just the suppression of certain pathways, remarkable is the fact that we inhibit matrix degeneration and inflammatory material or substances like interleukin-1, and that appears to happen through multiple pathways. And we have inhibition of ossification, which is central to rescuing the cartilage. But the most important is what I mentioned also at the beginning, is inhibition of vascularization. So the cells effect on these localized cells is very different depending on the localized cell that belongs to the specific tissue. So we studied all the pathways that relate to inflammation that were affected by SMS cells through chondrocytes, and we noticed that all of them exhibit an inhibition. So we have a strong inhibition of inflammation. In fact, when we inject the cells intra-articularly, we don't see any transient inflammation, something that we see with other stem cells very obviously. And in addition to that, which is very nice, is that the cells inhibit also axonal development, and so many pathways related to the axonal innervation into the intra-articular space. So that will inhibit pain very significantly. That's exactly what we see with the patients. Very fast, 1 or 2 days, there is inhibition of pain after injection of the cells inside the articular space. And all that happens via actually, at least via chondrocytes gene expression changes. Most interesting also, and that I think we present that for the first time, is the effect of SMS cells on the differentiation of chondrocytes. Now, as I mentioned, proliferating healthy chondrocytes are actually produced by mesenchymal stem cells. So even activating mesenchymal stem cells is quite beneficial for proliferating chondrocytes. This occurs through the signal SOX9, And the further differentiation of chondrocytes is inhibited also by SOX9. It is promoted by RANKS2. The differentiation of chondrocytes produces apoptotic chondrocytes that are quite detrimental, and further the ossification of the tissue. So when we studied the effect of SMS cells on chondrocytes, we're happy to see that we actually promote using two different pathways, SOX9, and we inhibit RANKS2 with three different pathways. And this is, I think, the first time that ever a drug can produce that in chondrocytes. And why not, as I mentioned, SMS cells are very smart cells. So compared to other stem cells and cell therapies, SMS cells actually overcomes many, many bottlenecks, including safety, potency, scalability, targeting, engraftment, and survival. And this has been really hampering the industry. We think with SMS cells, we have now a solution for many of these regenerative challenges. We have applied these cells, of course, on dogs earlier on. And what we found is that with the intravenous injections, we achieve a lot of progress even without homing directly to the intra-articular space. So either way, we have great results. And these cases were quite surprising to the owners. In this case, for example, a lethargic dog was able to play frisbee after two intravenous injections that were administered. We did also other studies, like, for example, intravenous injections in the dogs that resulted in limb salvage. And this is a dog, an older dog, 13 years old, where the wound got all the way to the bone. We were able to rescue that foot and have regeneration of the wound. This is a side effect that we didn't expect, actually, because we were targeting the discs and the joints. The other thing is, of course, the effect of the SMS cells on tendon, which is quite interesting. This is a treatment on horses where we are able to regenerate the tendon within 1 month or actually less, which is quite surprising and amazing in this case. For horses, this is a very difficult treatment. We are applying the cells on multiple indication, obviously. Joint orthopedic indication will be our main indication after the pulmonary, sorry. And during actually the pulmonary applications, which is now run mainly in Australia on phase 1 trial. So just to summarize quickly, so we have SMS cells that target several types of cells that are key to tissue regeneration. So even the binding itself tells us that these cells are very important for tissue regeneration. And we've seen that also at the level of gene expression changes at the cellular level in terms of proliferation or inhibition of proliferation. So these can address parenchymal cells as well as other type of cells that are quite prevalent in many tissues, like mesenchymal stem cells. So they activate these mesenchymal stem cells, which are known to be important promoters of tissue repair. They can proliferate extensively without loss of potency. This allows us scalability and will provide these cells in large numbers for many patients. They are sturdier, more robust, easier to handle and store. We can store these cells at refrigerator temperature for 26 days. That's the only human cell that can achieve that. It's a testament to the uniqueness of these type of cells. We have, of course, environmental resilience. I mentioned that before. And we never seen actually any significant immune reactions tied to these cells, no transient or localized inflammation. And that's mainly due to the lack or the deficiency in major histocompatibility proteins at the surface of these cells. They are a safer alternative, definitely, to embryonic and genetically engineered cells. These are native cells, not genetically manipulated. Their natural habitat is blood, so we don't need to take them from tissues. And when we introduce them to the blood, they perfectly fine. We tested that on several patients, in animals and humans. And it's interesting that they have an effect across species. So the same human cell has an effect on a human, rat, and horses and dogs and mice. So this is quite extraordinary, I think, and needs warrants attention. Thank you very much. This is some of our advisors. We're quite thankful for them, and also for our co-workers who work diligently on promoting this technology. We had a recent publication at the European Society of Medicine about the transformative paradigm related to small mobile stem cells. So I invite you to visit that publication that was published in October. Thank you.
Thank you, Doctor, for your informative presentation. You can drop your email ID in the chat box. If anyone has any question, they will email you.